Now, how can social media help us? Social media gives us the opportunity to share our stories. The English author Harold Goddard, he wrote, "The destiny of the world is determined less by the battles that are lost and won than by the stories it loves and believes in." Have you ever turned on the television to a daytime talk show and they may have a segment on vaccines and autism where on one side you could have a healthcare professional, it could be a doctor, nurse, or someone from public health, and she will have mountains of evidence on her side, but she will speak in a language of numbers, data, and statistics. And on the other side, you may have a parent whose child has autism she thinks may be associated with vaccines. And she will share a powerful personal story. She will say things like, "My son is my data." And that story will have tremendous resonance in the court of public opinion. It's time that we in healthcare, we share our own stories. Like that time a few years ago, an infant, too young to receive the MMR vaccine. She got sick with the measles. And the only thing she did was go to a routine pediatrician's appointment and was exposed to an unvaccinated child in a waiting room. Now, I know these stories may not convince the most extreme vaccine denialists, but just maybe they can make a difference to parents who are on the fence and unsure about vaccines. In her famous TED Talk, Brené Brown, she said that stories are just data with a soul. Stories put a human face on the evidence that we rely on to teach and treat our patients. Social media gives us a stage for us to share our stories. Brian Vardabedian is a clinician social media leader, and he estimates there are about 60 to 70,000 pediatricians in this country. Imagine if every single one of them wrote one blog post a year to share their story about vaccines and autism, and how that flood of reputable healthcare information can drown out the online presence of the vocal anti-vaccine minority. Now, what if we can use social media to communicate with patients in real time? And of course, there are tools for that already, like Twitter. Twitter's bringing doctors closer to the patients, and I want to tell you about one of those patients. Her name is Erin Turner. And for years, Erin had been having wrist pain, and the only option her local orthopedic surgeon could offer was wrist fusion surgery, and she wasn't too excited about that. So one day, she was reading USA Today and came across a story of Major League Baseball player Jason Worth, who also had been having chronic wrist pain, and he was diagnosed with what's called a UT split tear, which is a tear down the middle of one of the wrist ligaments. And as part of this story, USA Today arranged a Twitter chat with a doctor who discovered the UT split tear. His name is Dr. Richard Berger at the Mayo Clinic. So Erin did what a lot of patients do. She Googled him online and found that he had a pretty broad online presence. He did YouTube videos, podcasts, and blog posts. And she liked what she saw, so she decided to participate in this Twitter chat where she was able to engage with Dr. Berger directly, ask him a few questions, even describe her situation to him. Well, Dr. Berger knew better than to give personal medical advice on the web, so he suggested that she seek a second opinion. Well, Erin, the patient, she did better than that. She actually traveled to the Mayo Clinic and saw Dr. Berger directly. And he evaluated her and indeed diagnosed her with a UT split tear. And after surgery and a period of recovery, her wrist symptoms slowly went away. And this is a stark example of how Twitter can tear down those healthcare walls and facilitate the connection between doctor and patient. Now, what if we could pull the curtain back on medical errors and use social media's transparency to improve patient safety? This gentleman, his name is Paul Levy. He's the former CEO of Beth Israel Deaconess Hospital in Boston. And when he was CEO, he was one of the few who had an active blog. And he will talk about things most hospital CEOs won't blog about, like the infection rates in his intensive care unit. He'd blog about medical mistakes at his hospital. And he famously told a story of a patient who went to his hospital for foot surgery. And when this patient woke up in the recovery room, he looked down at the bandages on his foot and asked the doctor beside him, "Doctor, why are the bandages on my left foot instead of my right?" And to that doctor's horror at that moment, he realized he had operated on the wrong side. And when Paul heard about the story, he didn't get angry or upset or further punish the medical team. He wrote about it on his blog. Now, why would he do that? It's because he believed that real-time public disclosure can be mutually instructive. He didn't just want his medical staff to learn from the mistake. He wanted others reading his blog to learn from it as well. Paul believed that transparency, openly writing about a medical error on a social media platform like a blog, could do more for patient safety than the opaque and adversarial way we deal with medical mistakes today. And the Institute of Medicine recently released their report on medical errors, and one of their recommendations was to reform our medical liability system so we can be more transparent and less adversarial. So by focusing on social media's transparency, you could say that Paul was ahead of the curve when it came to patient safety. A lot of other clinicians I talk to are a little bit apprehensive when it comes to their online presence. So what normally shows up are pages from clinician rating sites. And these sites give doctors a tremendous amount of anxiety. You just get a group of physicians together and just say the words online doctor ratings, and it evokes this visceral reaction. I remember going to a conference last year to talk about online reputation, and I walked into the convention hall, and the organizers rushed up to me. They said, "Kevin, you're going to tell us how to get rid of these sites, right?" And I thought to myself, no, I'm not. Because if you look at every other industry, whether it's books, movies, hotels, restaurants, people want to know what others are thinking. Before I buy something, I go to Amazon and I read the reviews first. Online ratings, they're not going away. More of us are going to be standing at bedside saying, you know what, I've been doing this for 20 years, and patients may say, yeah, I can see that. Yelp says mediocre at best. Clinicians who have a prominent online presence are going to have an advantage when it comes to connecting with patients who may be looking for them online. Clinicians need tools that are powerful in the eyes of Google and allow them to create that content online. And of course, those tools are now available. They are, of course, social media platforms, blogs, Facebook, Twitter, LinkedIn, YouTube. They allow clinicians to create that content that gets ranked high on Google searches.